Hello and welcome to Rosie the Riveting RN. Today we're going to be covering another chapter. And the only thing is that what's going to be different from the first recording is that we're only going to do a small section of the textbook instead of the entire chapter because that can be very overwhelming. So let's get our highlighters, pens, and our notebook paper ready, and here we go. We're going to go over chronic neurologic disorder, and today we're going to break down what a seizure is. A seizure is a sudden, abnormal, excessive electrical discharge of neurons in the brain. During a seizure, multiple neurons fire at a rate much faster than normal, causing involuntary movements, sensory phenomenon, emotional expression, and unusual behaviors. Seizures may accompany a variety of disorders or occur without any apparent cause. So, what does that paragraph tell you? Now, we're going to take it paragraph by paragraph. Basically, a seizure, what is it? It's sudden, abnormal, excessive electrical discharge of neurons in the brain. And so basically, the brain just functions at a much rapid rate than what the body can tolerate. So this causes involuntary movements, sensory phenomenon, emotional expression, and unusual behaviors. So that's stuff that we can actually jot down. So we take our notebook. What is it? It is sudden, abnormal, oops, that's an X, excessive electrical discharge of neurons in brain. Right? That's basically what it is. Now, seizure disorder or epilepsy is a group of neurologic diseases marked by recurring seizures. If a person has two or more seizures more than 24 hours apart without an underlying problem that caused the seizure, they may have a seizure disorder. Seizures from systemic and metabolic problems are not seizure disorders if they stop when the underlying problem is corrected. So, what is that sentence or that paragraph telling us? It is saying that seizure disorder is also known as epilepsy, and it is a group of diseases marked by recurring seizures. Marked by recurring seizures. This qualifies if the person has two or more seizures than 24 hours apart without any underlying problem. That's what that is saying. It is the fourth most common neurologic disorder. About 3.4 million or 1.2% of the American population have seizure disorder. 1 in 26 people will develop seizure disorder during their lifetime. It affects men and women of all ages, races, and ethnic backgrounds. So the biggest takeaway, it is we're going to jot down what a seizure disorder is. And this is equivalent to or the same thing as epilepsy. And this is recurrent seizures, which is two or more. Oops, let's bring that so you can hear it. You can see that. Two or more seizures more than 24 hours apart. With no underlying cause. Okay, so that's that. Now, etiology. How does this happen? Right, that's the next thing we're going to look at. Now we got the what, now we need the how. So most persons, the cause of seizure disorder is unknown. We don't really know why people have it. These cases are known as idiopathic generalized epilepsy, right? Anytime that we have idiopathic, that means we don't know why you have it. Known causes include stroke, brain tumors, cerebral infection, traumatic brain injury, hypoxic birth injury, neurodevelopmental disorders, neurodegenerative disease. Other common causes include low or very high glucose levels, abnormal serum electrolytes, eclampsia with pregnancy, lack of sleep, and alcohol withdrawal. Children may have seizures with a high fever. Medical problems may cause seizures include hypertension, sepsis, heart and lung, liver, or kidney disease. Immune factors may influence seizure disorders. Patients with autoimmune disease like systemic lupus erythematosus and MS have inflammatory changes in the brain, increasing seizure risk. Research into the role of neuroantibodies in seizures is ongoing. So basically, we know that this is caused by all of these, right? Hypoxic birth, neurodevelopmental disorders, neurodegenerative disease. It can be high fevers in kids. It can be pregnancy, lack of sleep, alcohol withdrawal. It can be basically organ disease. You become sepsis. You can have SLE, that lupus, and MS. Those are the biggest takeaways in that paragraph. So, what are we going to jot down? How does this happen? It can be due to, number one, let's do that, unknown. Other known reasons is a stroke, hypertension, tumors, brain tumors. Oops. Cerebral infections, brain injury, hypoxic birth. It could be neurodevelopmental disorders, pregnancy, lack of sleep, high fever in children. I'm just going to condense it, organ disease, and sepsis. Okay. Seizure disorder is characterized by a group of abnormal neurons that seem to fire without a clear cause. This may happen due to the release of excitatory neurotransmitters or by an absence of neuroinhibitory activity. Both allow abnormal excitement of neurons leading to excessive discharge of electrical activity. Any stimulus that causes the neuron's cell membrane to depolarize can cause this firing, which spreads by physiological pathways. Localizing the seizure focus, the place where the seizure originates, is critical to the success of any surgical treatment. What is the biggest takeaway of this paragraph? It's going to be so we need to localize the seizure. That is critical to success of any surgical treatment. And let's see what else. So it's basically that is the biggest thing. This may happen due to the release of excitatory neurotransmitters. Great. But that's the biggest thing that I would take away from there. Knowing the location of the seizure is key. So we're going to jot that down. There is a genetic link, one or more genetic abnormalities, up to 70% of people with seizure disorder. Seizure disorder can develop from the interaction between genetics and environment. Some genetic diseases cause brain malformations that lead to a seizure disorder. Gene mutations that cause a low grade threshold, a change in nutrient metabolism, or neural migration in the brain development can lead to seizure disorder. Patients with chromosomal disorders such as Down syndrome often have have a seizure disorder. So, genetic abnormalities can be caused or a cause, and we see this in Down syndrome patients. So we're going to jot that down. Then we go into clinical manifestations. What does it look like? Your signs and symptoms. Specific manifestations of seizures are determined by the site of electrical disturbance. The Internal League Against Epilepsy has developed a classification system for seizures. This system divides seizures into three major classes based on where the seizure activity begins: generalized onset, focal onset, and unknown onset. 60% of patients have focal seizures. Seizures within each classification as seizures within each classification as motor or non-motor and by levels of awareness. These descriptors address what occurs during the seizure. It may not be easy to figure out what type of seizure a patient is having. Seizures may begin with a single focus, but may spread and become generalized throughout the brain. So, biggest takeaway, there's three major types: generalized onset, focal onset, and unknown. They are also broken into motor and non-motor and by level of awareness. They can begin as a focal seizure but spread and become generalized. Those are the biggest takeaways. Depending on the type, a seizure may occur in 4 phases. This is the prodromal phase, with sensations or behavior changes that precede a seizure by hours or days. 2. Oral phase, with a sensory warning that is similar each time a seizure occurs and is part of the seizure. 3. Ictal phase, from first symptoms to the end of the seizure activity. And post-ictal, that is going to be the recovery time of after the seizure. Not all patient has every phase. So let's go into the certain types of generalized onset seizures. So let's do our little chart. We're going to set that up on our notepad. So, generalized onset seizures start over wide areas of both sides of the brain. They are characterized by bilateral synchronous neural discharges. In most cases, the patient has impaired consciousness for a few seconds to several minutes. Generalized seizures are either motor or non-motor. Motor developments are bilateral. So, what is this saying? So, generalized onset seizures, it is over a wide area, both sides of the brain, bilaterally affecting the brain. The patient is going to have impaired consciousness for a few seconds to several minutes, right? Those are things that can happen. And they can have motor or non-motor manifestations. So we're going to jot that down. So it starts, so it's over a wide area of the brain. Loss of consciousness, and then they can have motor or non-motor. And then their motor, that's going to be bilateral. So happening in both sides of the body. So let's look at our tonic-clonic seizure. This is a type of a generalized seizure. So this is formerly known as a grand mal. This is typically the one where that you would think of with a seizure based off of what you usually see in the movies and in TV. So it is the most common generalized onset motor seizure. Um, During a tonic-clonic seizure, the patient loses consciousness and, if upright, falls to the ground. The body stiffens, which is the tonic phase, for 10 to 20 seconds, and then the extremities jerk, which is the clonic phase. This may last 30 to 40 seconds up to several minutes. Cyanosis, excessive salivation, tongue or cheek biting, and incontinence may occur during the seizure. So, what are your signs and symptoms? It is the loss of consciousness. You can fall to the ground. You have the tonic clonic phases or stages, I should say. And then this can last for quite a while. You can be cyanotic, I should say. You can have excessive salivation, you can bite your tongue or cheek, and you can be incontinent. So you basically lose complete control of your body. So, AKA grand mal. LOC, loss of consciousness, fall to the ground. So you have tonic clonic manifestations. You can be cyanotic. You have increased salivation. Bite your tongue or cheek. And you can be incontinent. So those are your biggest takeaways. In the post-ictal phase, the patient usually has a muscle soreness, feels tired, and may sleeps for several hours. Some patients do not feel normal for several hours or days after a seizure. The patient has no memory of the seizure. So what's the biggest takeaway in this paragraph? It's going to be they have muscle soreness in the post-ictal phase. They feel tired, and they're going to sleep. Some patients do not feel normal. They do not feel normal for quite some time, and they have no memory of the seizure. So those are things that we're going to write down. Post-ictal phase. Let's get this out of the way. So they have no memory of the seizure. They're sore, fatigued, and sleepy. Okay, that's how you want to break that down. Other generalized onset motor seizures, other types of generalized onset motor seizures include tonic and clonic. A tonic seizure involves a sudden onset of increased tone in the extensor muscles, contributing to sudden stiff movements. Tonic seizures most often occur in sleep and affect both sides of the body. Patients will fall if they are standing, and then the seizure occurs. Tonic seizures usually last less than 20 seconds. The patient usually stays aware. Clonic seizures begin with a loss of awareness and sudden loss of muscle tone, followed by rhythmic limb jerking that may or may not be symmetrical. So, what is the same? So, there is a type of just a tonic seizure, and that is going to be sudden stiffness And then this often occurs in sleep and affects both sides of the body. They can fall if they're standing. It usually lasts less than 20 seconds, and the patient is usually aware. Whereas with clonic seizures, there is a loss of awareness, sudden loss of muscle tones with rhythmic limb jerking, may or may not be symmetric. So it's a little bit different. So we're going to jot that down on our notes. So we have tonic. That is going to be sudden stiffness. Well, sudden stiff, should take that out, movements. Usually happens in the sleep. And bilateral. Can cause fall. And last less than 20 seconds. Then we have our clonic. Whoop. That is going to be loss of consciousness. Oh yeah, and patient is aware. So loss of consciousness, sudden loss of muscle tone. Then with rhythmic jerking, can be unilateral or bilateral. Generalized atonic seizure, or known as a drop attack, involves a brief, sudden loss of tone. It may affect just the head and neck or result in the person falling to the ground. Seizures typically last a few seconds. There is a brief loss of consciousness and a brief postictal confusion. Patients with atonic seizure are at risk for a head injury. They often need protective helmets. So then we have our atonic seizure. It's a drop attack. That is going to be brief loss of tone. They usually do fall. They do have a loss of consciousness and post-ictal confusion. They need helmets. Right? So we can kind of highlight. So as we're reading through our notes, we notice, okay, here's the different ones, and it kind of stands out, right? So it is a drop attack, brief loss of tone. They can fall to the ground. It's a loss of consciousness. They have a brief post-ictal confusion, and they often need helmets. So then we have generalized onset non-motor, also known as an absent seizure. Absent seizures most often occur in children. They rarely occur beyond adolescence. This type of seizure occurs more often in girls. It usually begins between ages 4 and 8. They may stop altogether as the child matures or evolve to another type of seizure. A typical absence seizure is marked by sudden onset brief staring spell that resembles daydreaming and sudden recovery. It often goes unnoticed because it lasts less than 10 to 20 seconds. Usually the patient is unresponsive when spoken to during the seizure. So this is a pretty unique one because we do often see it in kids. The way that it looks is so a typical absent seizure. It is sudden onset of a staring spell, looks like daydreaming, and then they suddenly recover. It usually goes unnoticed because it lasts for a very short amount of time. They are unresponsive when you try to talk to them. In an atypical absence seizure, the staring spell is accompanied by other signs and symptoms such as eye blinking or jerking movements of the lips and repetitive finger movements, which is automatisms. This type of seizure often lasts as much as 30 seconds with a gradual beginning and end. If the patient has existing cognitive problems, it may be hard to tell seizure activity from usual behavior. Atypical absence seizures usually continue into adulthood. So, this is where you do have that staring spell, but then you have other stuff going on like eye blinking, jerking movements of the lips, repetitive movements of the fingers. It lasts longer than an atypical seizure, um, and it can continue in adulthood. So, we're going to jot that down. So, we have non-motor, generalized seizures. That's going to be absence seizures. That's going to be a staring spell, common in kids. Looks like daydreaming. Lasts less than 10 to 20 seconds. Unresponsive during the seizure. And usually kids will grow out of it. Or it just manifests to a different type. So then we have atypical absence seizure. And this is going to be the staring spells plus you're going to have some repetitive movements. Can last in adulthood. And then seizures last about 30 seconds. Okay, so that's the biggest takeaway. So then we know that this is our non-motor seizure, it's our absence, and our atypical seizure. Okay, then we go on to our focal onset. Okay, so what is a focal onset? That is going to be formerly known as a partial or partial focal seizures. They are the other major class of seizures. Focal seizures begin in one hemisphere of the brain in a localized region of the cortex. They cause sensory, motor, cognitive, or emotional manifestations based on the function of the involved area of the brain. For example, if the discharging focus is in the medial aspect of the postcentral gyrus, the patient may have paresthesia in the leg on the side opposite of the focus. This can help discern the type of seizure. So basically, this is saying that this is what this used to be called, And this is a focal seizure. It begins in one hemisphere of the brain and it is localized to a specific area. It can cause sensory, motor, cognitive, or even emotional manifestations. And it really depends on the area of the brain that is going to be affected. So, focal seizures are motor or non-motor. Motor activities include atonic, clonic, myoclonic, which is very rapid, irregular, brief jerking. Some people show strange behaviors such as lip smacking, picking at clothes, or other repetitive, purposeless actions. With a focal non-motor seizure, the patient can have emotional manifestations or autonomic symptoms. So basically, there's motor and non-motor. What does motor include? It's going to be atonic, clonic, myoclonic. And then they can also have strange behavior changes, lip smacking, picking at clothes, or repetitive, purposeless actions. With non-motor seizures, the patient can have emotional manifestations or autonomic symptoms. So let's jot that down before we go any further. So basically, it is going to be it's a focal point. So you have motor, that's going to be clonic. Oops. That is going to be, where am I? I lost myself. Atonic, and then myoclonic. You can have strange behaviors, repetitive movements, lip smacking, should be a C right there, and then your non-motor. That is going to be emotional manifestations. You're going to have more emotional changes. Or autonomic symptoms. Okay. So, a patient with a focal onset seizure may be described as aware or impaired. In focal awareness seizures, patients are conscious and alert, but have unusual feelings or sensations. They may have sudden and unexplainable feelings of joy, anger, sadness, or nausea. They may hear, smell, taste, see, or feel things that are not real. Some have localized twitching. In a focal impaired awareness seizure, patients have a loss of consciousness or change in awareness, producing a dreamlike state. Their eyes are open. They make movements that may seem purposeful, but they cannot interact with others. During a seizure, some people may do things that can be dangerous or embarrassing, such as walking to traffic or removing their clothes. They may continue an activity started before the seizure, such as counting coins or choosing items from a grocery shelf. After the seizure, they do not remember the activity performed during the seizure. Seizures usually last 1 to 2 minutes. Patients may be tired or confused after the seizure and not return to normal activities for hours. The degree of awareness can be unspecified. So, we have our focal awareness seizures. They're going to be alert. They're going to have unusual feelings or sensations. They can have unexplainable feelings, nausea. They can hear, smell, taste, see, or feel things that are not real. Maybe even localized twitching. In a focal impaired awareness seizure, patients have a loss of consciousness or change of awareness, and this can cause a dreamlike state. Their eyes are open. They make movements that may seem purposeful, but they cannot interact with others. During a seizure, some people may do things that seem embarrassing, like taking off their clothes. They may walk into traffic, and they continue the activity that they even started prior to the surgery. It can last for 1 to 2 minutes. They can be tired or confused after the seizure, and then they may not return to their baseline for quite a while. So let's break that one down. So we have our focal awareness. So they are alert. They have change. So delta is kind of shorthand for change. That's a delta. So change in emotions, behaviors. They can have smells. They can hear things. They can taste or feel things that are not real. So that's how you would break that down. Okay, we're continuing our comparison chart. This is our focal, and this is our generalized. So then we have focal impaired. So basically, there's a change in awareness or a loss of consciousness. They do have a dream-like state. There's no interaction with others during the seizure, and then they can do dangerous things. They will be tired and confused afterwards. Okay, so those are things that are good to know. So then we have psychogenic non-epileptic seizures. Psychogenic non-epileptic seizures, known as PNES, imitate seizures but are triggered by emotional events, not neuronal activity. Because of the close resemblance, we may misdiagnose PNES as a seizure disorder. Proper diagnosis usually requires video EEG monitoring during an attack, a history of emotional or physical abuse, or a specific traumatic event that often emerges. Treatment includes cognitive behavioral therapy, serotonin reuptake inhibitors. So what is this? So this is PNES. It imitates a seizure, but it's not a seizure. And then what this happens is there's emotional, it's caused by emotional events, not actual neurological activity. We're going to encourage cognitive behavioral therapy and serotonin reuptake inhibitors in these patients. And how are we going to diagnose them? With an EEG. That's how you break that one down. Okay, so let's take a break here. It's been about 40 minutes, so let's take a break. You can do your own notes, take a walk, and I will see you in the next video.